Hello, and welcome to another episode of Conversations with Dr. Westman, proudly brought to you by Adapt Your Life Academy. Today, we're going to be chatting about understanding your cholesterol tests. Last week, we spoke about the different tests one does when looking at your cholesterol profile. Today, we're going to learn how to understand your cholesterol tests. We also have a special bonus for you today, brought to you by Dr. Westman. It is his new guide, The Truth About Keto and Heart Health. We'll tell you a little bit more about this at the end of today's episode, and we'll also put a link for you in the description. So let's get started. So we understand that we test total cholesterol, we test LDL, HDL, and finally triglyceride levels. Let's go through each of them, and you can help us unpack the facts of why we test these and how to interpret those results.
Sure. And remember, it's important to test a fasting sample, meaning one that's checked after not eating for 12 hours or so, because the food that you eat can change these values, and the prediction of heart disease and stroke outcomes were done when people were in fasting states, after they had not been eating overnight. So when you take a fasting level, like a total cholesterol and LDL and HDL and triglyceride, you can think of them in terms of kind of on the good side and the bad side. So bad meaning the higher the number is, the worse off it is, or the higher the risk is. So total cholesterol, LDL cholesterol, and that's the cholesterol in the LDL particle, the triglyceride level. These would be on the spreadsheet or the balance sheet of being the ones that give you risk. So the total cholesterol, LDL, and triglyceride are the ones that the higher they are in the blood, the more risk that you'll have down the road for having a problem. So the HDL cholesterol is on the other side of the balance sheet, if you will, as a good protective factor. So, just thinking in those terms, you would never want to just look at a total cholesterol without knowing the HDL cholesterol. And it always was more convincing to me to look at ratios. So taking the total divided by the HDL, for example. So you're balancing one of the things that confer risk with one of the things that protect you, the HDL. So looking at a total cholesterol HDL, even an LDL, total cholesterol HDL, or an LDL HDL ratio gives you a balance between the total, the bad one, and the HDL, the good one, LDL being the bad one, HDL being the good one, and even the triglyceride divided by the HDL, or the triglyceride HDL ratio, gives you a balance between the factors that confer risk and the factor that's protective, the HDL. So that's why, long story short, you would never look at just one number and say, okay, here's the result. Even though I see doctors doing that all the time, focusing on just one number. You would always want to have the LDL or total or triglyceride balanced by the HDL. And one simple way to balance it is to take the ratio, or take the bad number divided by the good number. So when you look on some of these results, you'll actually see that as the total cholesterol HDL ratio, or an LDL HDL ratio, or a triglyceride HDL ratio, or you could just do that yourself. So often I'll take the test as written out and provide that ratio just by taking the total cholesterol divided by the HDL numbers, and you come up with a ratio. So a total cholesterol of 200 and an HDL of 100 would give you a 200 divided by 100, a ratio of 2, for example. So that's the factors that confer risk, that give you risk, are the total cholesterol, LDL, and the triglyceride. The factor in the blood that protects you is the HDL cholesterol.
So just to reiterate, it is not wise to simply do a test, look at and be alarmed at either your total cholesterol or just your LDL cholesterol. It is really by looking at the entire lipid profile, understanding the ratios, and those ratios will give you some measure of a better risk factor. rather than just
Yes.
looking at individual numbers.
Yeah, and I just have to honestly say a lot of doctors don't take that HDL into consideration. So I'll see many of my patients will be fear mongered, even kind of bullied into taking a medicine or making a change based on just one number without addressing the other numbers. So it's common for me to say, well, look, yes, that LDL or total cholesterol is a little high, but look at how high your HDL cholesterol is. And on the lifestyle approaches that include more fat, the HDL goes up, which is protective. So I will explain, well, right, the kind of the old way is to look at the total in LDL by itself. But even then, I prefer, and in the history of checking cholesterol, there's always been that ratio of the total divided by the HDL, the LDL divided by the HDL. It's just harder to roll that out into guidelines and simplify it. So a lot of doctors just look at that LDL number. But you would always want to also look, and I'll say, no, look, that LDL is up a little bit, but your HDL, my goodness, it's 90, which in fact, on the lipid panel results, it'll say an HDL over 50 is protective. So it's as if half of the whole cholesterol story has been ignored, because the HDL cholesterol, when that's elevated, that's actually protective. It doesn't really matter what the total and LDL are. And again, it's kind of a simplifying, as you know, this is complicated. And one way to simplify it is to only look at one factor. But it's reassuring to see that the HDL goes up, and that if you take those ratios, you're going to get the full picture.
So I'd like to drive this point home properly, because we get a lot of emails at the academy, and so I've been on a keto diet, my LDL shot right up, and they totally discount what their HDL is doing, and they totally discount what their triglycerides are doing. So I'd like to look. I'm in South Africa. We use a different measure. I think we use millimoles per deciliter. You use, what is it? Two different ways of measuring. Milligram. Okay. So for an example, somebody that's got a relatively high total cholesterol and a relatively high LDL level, however, they've got a high HDL level and a very, very low triglyceride level. Now, just to explain a little bit further, it is preferable to have your HDL as high as possible, and it is preferable to have your triglyceride under 1. I don't know if that's the same measure in America. In South Africa, it's always advisable to have it under 1, but to have your triglyceride level as low as possible. These two factors are huge when it comes to looking at or trying to determine some sort of cardiovascular risk profile.
Yeah, and to translate the triglyceride, that would be under 80 in the units that we use. Yeah. Okay. So, well, another way to look at it, though, is there's been an evolution, a paradigm shift of understanding of cholesterol in the blood. And the old way was just looking at total and LDL. It's kind of, I use the metaphor of it. It's kind of like using a flip phone. I mean, it can work, but the triglyceride HDL and the triglyceride HDL ratio is kind of like using a smartphone. It can do much more, and it's maybe like a new technology. Think of it that way. And it's also known as the metabolic syndrome, the blood components of metabolic syndrome. I didn't want to get into the weeds about that, but this is just a solid component in the blood of what metabolic syndrome represents. The triglyceride and HDL is what you look at on the lipid profile, the cholesterol panel, not the total and LDL. Even today, when you go to one of these calculators online to assess your risk, LDL isn't even one of the things that's asked for. It's the total and the HDL that's asked for on these. And I think partly is because, as we learned last week, a lot of these lipid profiles don't even measure the LDL directly. It's just a calculation. So I try to explain that it's the old way, the new way, and a lot of doctors still are focusing on the old way, sadly.
So to bring home your point that you just mentioned now, where the new science is going in a different direction. A couple of years ago in South Africa, we've got a massive a giant medical aid company where the majority of people are on. And every year that you'd go and do an assessment, and they would always, want your cholesterol to be, your total cholesterol to be below a certain level, and they would only test total cholesterol. Well, it turns out in the last 2 years now, they're actually more concerned now about the ratios, and they actually don't care about the total cholesterol anymore. So it's interesting that you talk about the old way of thinking and the new way of thinking. I also know that you recommend a couple of different tools for folks to be able to go and see what sort of risk profile they have. Maybe you can mention what that tool is, and the fact that you're correct, they don't even have LDL as one of the metrics when looking at your cholesterol lipid profiles.
Yeah, well, one of the major organizations' guidelines is put into an online calculator. You need to know your blood tests and your blood pressure levels, and they ask you whether you're a smoker, whether you have diabetes, high blood pressure, your age, your gender, your race. That's the cvdriskcalculator.com. CVD meaning cardiovascular disease. Another one that I use a lot, but it takes time. So a lot of doctors won't do this or don't know about it, is the Mayo Clinic statin decision aid. And you just Google that, it will come up and ask you to put in your information. The Mayo Clinic decision aid is designed for a doctor to use to go over with a patient, because it talks about the risk, the number of people out of 100 who will be at risk. And then when you use a treatment, what will the risk change to? And it's not immediately obvious to people how to understand that. But if you're a quick starter and can figure those kinds of things out, I highly recommend these tools to see, because they do keep the HDL in that formula for you. And of course, it assumes lots of other things, like it assumes you're eating an standard American diet. And as you mentioned, people who use low carb, higher fat diets can have higher LDLs and higher total cholesterol. And I reassure people about that, because the HDL goes up. But in these cardiovascular tools, they're assuming that you're eating a regular American diet, because that's where the tool is derived from. So in fact, if you're following a low carb diet and you've done it a long time, you're looking at these blood tests, I would recommend that you do the advanced testing of the arteries directly, because in some cases, the blood tests are way out of the bounds of what has been seen before. In fact, there's a group, the lean mass hyper-responders. If you have a really high LDL level, they're studying themselves now. You can get involved in a study where they fly you out to LA, Los Angeles, to get a CT angiogram, which is of the heart, which is actually not a coronary score. It's actually directly measuring the arteries themselves. Dave Feldman, who is the blog owner or a website owner of cholesterolcode.com, also has a website called citizenscientist.org, or Citizen Science Foundation, citizensciencefoundation.org. And you can actually see if you qualify for being involved in this study. I think you have to have an LDL over 250 in American units. So that would be, almost twice or 2.5 times the upper limit that, quote, you normally want in people who are using the old risk factors, the LDL. Anyway, you can actually be involved in research to advance the understanding of this kind of cholesterol phenomenon among people who don't eat carbohydrates, who follow a low carb or follow a keto diet.
Now, I want to talk a little bit more about the triglyceride level, because I feel that is one of the elements that is really misunderstood and not spoken about enough. How important is a low triglyceride level in the blood?
Yeah, it's extremely important. And it's been known for a long time. There are some studies going back to the 1980s showing that you could reduce recurrent heart attacks with lowering the triglyceride level with drugs. So, that's kind of the story of cholesterol, and the treatment of it is it's a drug story in the medical world. So because there were no drugs that worked really well and were widespread to treat the triglyceride, it doesn't get quite as much widespread attention. There are some specialty lipid or cholesterol clinics, the lipid doctors, and they take the triglyceride very seriously. They will use a drug called niacin, which is really kind of a vitamin at high dose, or gemfibrozil, these fibrates. And so they've always, if you're a lipidologist, you take advanced testing and training to learn how to manage all of the blood components. They take triglyceride seriously, but the general doctor has only learned about the LDL. So you want the triglyceride to be very low. It turns out that the particle that carries triglyceride on in the blood, the VLDL, is what leads to the small LDL in the blood. So it's the triglyceride, and the arterial damage is directly related because of the particle that it's carried on. The VLDLs lead to the small LDLs in the bloodstream, and that's the one that is the bad LDL. There's a good and the bad LDL, and the small LDL is the bad one.
And just to mention again, it's my understanding that somebody that does practice or follow a low carb or keto type of diet that does include some higher amounts of saturated fats in their diet, their triglyceride levels have been historically shown to be very, very low on this way of eating.
Yes, and that people say it's counterintuitive. You eat more fat and the fat level in the blood goes down. It's because you're burning it. Because when you may be eating more fat, but you're burning more fat as well, so that your level in the blood actually goes down, which makes sense. It's not counterintuitive unless you were taught the different way. So yeah, higher fat diets do two things for the blood that's very, very good in the cholesterol world, and that is higher fat diets raise the HDL, the good cholesterol, and they lower the triglyceride level.
Now, Eric, we spoke a little bit last week about the carotid artery test. What sort of levels are we looking for here in that sort of a test?
Well, ideally, there would be no evidence of any disease, right? So that if you're young, and young is defined in many different ways, but if you don't have any disease, then it should be what you would say that there's zero blockage at all. So these tests usually come back with a sort of a semi-quantitative scale. Usually it's none, mild, moderate, severe. So you don't get a number. It's more you're given the assessment of the operator of the test is looking with an ultrasound and giving an assessment of whether there's none, mild, moderate, or severe. And if you're in your 70s, 60s, and 70s, and you've been living in America and you've been eating an American diet, it's likely that you're going to have some disease. But if it turns out your family history never had any heart disease in it at all, or there was no stroke, then you may never develop disease, even if you're living in the US. So, and then you wouldn't want to worry about a blood test if you didn't even have the disease to begin with. So that's kind of the why are doctors thinking about this. So if you're 70 years old and you've eaten, kind of a moderately, bad diet, like an American diet, and you have no disease when you're 70, don't start having a doctor introduce worry about a disease that you don't have yet. That it would almost be like, here, take this pill because you're going to get cancer one day when you don't have cancer in your family. So the medical world has kind of oversold the idea that everyone's going to get heart disease and everyone's going to get atherosclerosis. It's highly likely you will if you eat a standard American diet. But if, let's say, you haven't been following a standard American diet, you can know if you have the disease or not. You don't have to have someone else kind of make that assumption for you.
Excellent, Eric. Well, thank you so much. And that's all we have time for today. Next week, we're going to dive a little bit deeper into those blood lipid profile ratios, or the cholesterol ratios. We're going to dig a little bit deeper there. Before you leave, remember that we have a special bonus for you, which is Dr. Westman's new guide, The Truth About Keto and Heart Health. It's brought to you by Dr. Westman. And if you're worried about cardiovascular risk, this guide is definitely one for you. If you'd like to learn a little bit more about our upcoming courses, we have a brand new course starting in November. We're very excited about this course. It's called End Your Cholesterol Confusion, and this will arm you with all the information that you will need to understand your results, to understand everything there is to know about cholesterol. If you'd like to either join the waitlist or learn a little bit more, you can find us at adaptyourlifeacademy.com. Eric, thank you so much for your time as always. We really look forward to catching up with you again next week. Until then, thank you so much.
Thank you.
Take care.